Good morning, everyone. This is Dr. Vaibhav Vaidya with the Fits on the Go block here at the ACC 2015 Legislative Conference. We're joined today by Dr. Kim Williams, current president of the ACC. Thank you for joining us today, sir. Can you tell us more about what population health initiatives the ACC is leading?
So first of all, I want to thank you and everyone else in the FIT Corps for joining us here at the Legislative Conference. This is our largest group of cardiologists ever going to Capitol Hill. And it's an opportunity to really influence the way we are viewed on Capitol Hill, and population health is one of those entryways. They are actually sort of taken aback when we first look at the fact that cardiologists are interested in population health, which on the surface would seem to decrease our income while we're trying to help people. And to a great extent, that's true. We are not doing this for self-interest. We're doing this because we really care about outcomes, and we know that we could do better. We've done a tremendous job of reducing cardiovascular morbidity and mortality, but we haven't necessarily made people well. We're just keeping them alive better than we ever have been able to do in the past. And so taking on population health really means that we look at prevention, look at strategies of getting people to understand what their risk factors are, understand that they need to have them addressed, both in terms of stopping them from occurring if they're at risk, as well as seeking treatment and following up and getting the control of hypertension, diabetes, and dyslipidemia. It's something that is really low-hanging fruit if we think about it. It just means that we really need to spend a lot of attention. And so we are capturing a lot of attention on Capitol Hill, as well as the White House, as well as regulatory bodies, to try to partner with us to try to make the health of the population better.
Great. So prevention is still better than cure. All right. The other question I have for you, Dr. Williams, is this year we've seen the passage of a new act, the MACRA Act. And can you tell us more about that and how that's going to be important for fellows in training and early career professionals to understand that act and how it's going to apply in our future?
Well, there's some parts of it that are not clear, but there are some themes that are very clear. Number one, we have removed the SGR, the Sustainable Growth Rate formula that was going to give us a 21% decrease in Medicare reimbursement is off the table. We now have moved into an area of sort of shifting from volume-based payments to value-based payments, where quality measurement will rule, essentially. And there will be a gradual transition, and we will be asked to do more and more in terms of reporting and registries, as well as making sure that we are above board in everything we do, making sure that we have appropriate use, for example, for imaging. And when those are basically what the provisions of MACRA will be. They will play out in very specific ways for each disease state over time. And our job for ACC is to make sure that we are at the table, so that our members are not on the menu, and making sure that they have our input, which they're welcoming, particularly as they know us now as a society that's not really a trade organization or a group that's looking for self-interest. We're looking to improve population health and transform cardiovascular care, and they expect us to be they're partnering with them to figure out how to get these measures for quality applied in a large way.
That's great. Well, thank you so much, Dr. Williams, for joining us here today and for your thoughts. For more coverage of the ACC 2015 Legislative Conference, please visit www.youtube.com/fitsonthego.